Pee addiction. Some of these addiction victims start innocently enough by looking at a few magazines and pictures. They often end up with full-on irresistible desires to look at pee material all the time. Viewing pee material that activates the part of your brain associated with pleasure and reinforcement. The new experience and excitement associated with pee can create a robust reward response in the brain similar to that experienced with substance addictions. You see, our brains weren't evolved to have access to so much material all at once. Evolutionarily, our primate-like brains were exposed to relatively limited stimuli compared to what is available through modern pee. Our ancestors likely encountered sexual stimuli primarily within the context of real-life interactions, meaning you'd have to talk to someone of your attracted gender to receive any sort of stimuli, which may have been more predictable and less varied compared to the range of content available in pee today. When you watch pee, your brain is like a child in a candy store, and given the choice to have as much as it wants. And, like a child, it's impressive at first, but with time, bad things are bound to happen to the mind with an infinite library of material at its disposal. Over time, repeated exposure to pee can lead to desensitization, where the brain becomes less responsive to the same stimuli. This desensitization can result in individuals seeking more intense or extreme forms of pee to achieve the same level of arousal and dopamine release tolerance. Gambling addiction. No matter what the internet tells you, 99% of all gamblers do not quit before they win big. Rather, casinos and other firms can trick those among the most complex things in the universe into one more spin: your brain. Interestingly enough, gambling affects the brain in a similar way to substance addictions. Similar to drugs, gambling stimulates the brain's reward system, releasing dopamine and other neurotransmitters associated with pleasure and reinforcement. The anticipation of winning and the thrill of taking risks contribute to the release of dopamine, creating a rewarding experience for the brain. Over time, the brain becomes conditioned to seek out and crave the dopamine rush associated with gambling, leading to compulsive behavior. It might be hard for you to imagine, but in the mind of a gambler, there is no greater happiness than sitting in front of a slot machine, pulling the lever over and over again. Each time the reels spin, there's a rush of anticipation. Will this be the big win? The anticipation triggers the release of dopamine in the brain. Even if the person doesn't win, the near miss, where the symbols on the reels almost align to create a winning combination, still activates the dopamine system, keeping them hooked and eager to play again. Over time, as the person continues to gamble, their brain changes. The constant stimulation of the reward system can lead to desensitization, meaning it takes more enormous rewards to produce the same level of pleasure. This can contribute to the development of tolerance, where the person needs to gamble more frequently or with higher stakes to experience the same high they once did. What starts as a $100 bet can almost instantly end up being $10,000 on black, as, funnily enough, the brain has an almost endless supply of these happy chemicals, meaning there is no risk addicts will miss to get just another high. Losing money on bets can still make your brain happy because of the rush it gets, making you want to gamble more, even when you're losing. Religion addiction. In most cases, religious and spiritual beliefs can provide meaning and community for many people. However, in some cases, an extreme focus on religious practices can become problematic. Signs that someone is too wrapped up in their religious practices include not listening to other people's ideas or beliefs, seeing everything as just right or wrong with no in-between, getting really upset if they can't do their religious rituals, ignoring important tasks or homework to focus on religion, and only hanging out with people from their religious group. What makes religious addiction unique from substance addiction is the behavior itself does not involve ingesting a drug. However, the compulsive need to ritualistically perform certain religious behaviors to achieve a state of emotional comfort or highs of perceived highs can activate similar emotions. Unlike alcohol or drugs, which can be stopped entirely, complete abstinence is usually not an option nor wanted for religion. This makes religious addictions similar to behavioral addictions like gambling or sex addiction, where moderation is the goal, not just avoidance. A strange but true fact, some people can get so caught up in religious rituals that they start feeling physical sensations like warmth or tingling during prayer or meditation, as if their body is responding to their spiritual experiences. Alcohol addiction. With the fact that your liver can sometimes handle over 30 years of abuse before it gives up, and how easily available most alcohol is, it should come as no surprise that this is among the most common addictions in the entire world. Over time, individuals develop a tolerance to alcohol, meaning they need to consume increasingly more significant amounts to achieve the desired effects. A common saying among alcoholics is that stopping alcohol does more damage than good. Perhaps paradoxically, this is true in some sense, as when alcohol consumption is stopped or reduced, individuals may experience withdrawal symptoms such as tremors, nausea, sweating, anxiety, insomnia, and in some cases, seizures or delirium tremens, DTs. DTs typically occur within 48 to 96 hours after the last alcoholic drink and are a medical emergency in most cases, with individuals having symptoms like severe confusion, disorientation, and hallucinations. Self-harm. Initially, at times, engaging in self-harm may activate the brain's regular opioid system, your natural pain regulators, leading to the release of endorphins, the body's natural painkillers. This can result in temporary relief or euphoria as the pain and emotional distress that caused the pain are temporarily alleviated. You see, the brain is wired to organize pain from A to Z, and depending on how bad it is, the higher up it is on the list, meaning the original pain is often lessened. As with other addictions, your brain becomes accustomed to the chemical changes associated with self-harm, and individuals may develop tolerance, requiring more frequent or severe self-harm to achieve the same level of relief or euphoria. Additionally, self-harm can become linked with other destructive coping mechanisms and emotional regulation strategies. Individuals may rely on self-harm as a means of managing overwhelming emotions, such as anxiety, depression, or trauma-related distress. So, in a cruel twist, the act of self-harm may provide a temporary escape from emotional pain or a sense of control in situations where individuals feel powerless. Each time the person undergoes any sort of stress, the body will naturally crave the pain to release the endorphins. During withdrawal from self-harm, individuals may experience a range of physical and psychological symptoms. Physically, individuals may experience discomfort or pain at the site of self-injury. After hurting themselves, some people actually feel calm and relieved because of the natural painkillers their bodies release. Psychologically, withdrawal from self-harm can be challenging, as individuals may struggle to cope with intense emotional distress without their usual coping mechanism. If you ever feel down or like there's no way out, please talk to someone and seek help. Self-harm is never the right option. Drug addiction. Certain drugs have the not-so-fun ability to hijack the brain's natural reward pathways, which are typically activated by healthy activities like eating, drinking, and sex. And when used, they cause a surge of dopamine, a brain chemical associated with pleasure and reward, leading to intense happiness. Over time, the brain adapts to the presence of these drugs, becoming less responsive to natural rewards and reinforcing the compulsive drug-seeking behavior. This means the same joy you would have gotten from hugging a loved one or eating is now replaced with the overwhelming desire to take the drug. Your repeated drug use leads to changes in the structure and function of the brain, particularly in areas involved in decision-making, self-control, and behavior regulation. These changes make it increasingly difficult for individuals to resist drug cravings and quit using drugs, even in the face of negative consequences. The brain's ability to experience pleasure from natural rewards is highly reduced, further reinforcing the need for drugs to achieve a sense of well-being. During withdrawal, the brain struggles to regain its normal functioning, often leading to intense discomfort and a strong urge to use the drug again to reduce the symptoms, as the brain has become so dependent on the effects these drugs have struggled to function normally without it. Your brain's reward and stress symptoms are now so disrupted during withdrawal, contributing to cravings, mood disturbances, and a heightened risk of relapse. Food addiction. While the food itself is not an addictive substance, the brain's response to certain types of highly palatable and rewarding foods can be just as addictive. Consuming foods high in sugar, fat, and salt make the brain associate these foods with intense feelings of pleasure and satisfaction, leading to cravings and compulsive eating behaviors. Individuals with food addictions may experience intense cravings and an overwhelming urge to consume certain foods, even when they are not physically hungry. The brain's reward system becomes abnormal, and individuals may prioritize food consumption over other activities or responsibilities. The pleasure and satisfaction derived from consuming rewarding foods can be a powerful motivator, leading to a cycle of cravings and overeating. Emotional factors such as stress, anxiety, or depression can tip them over to a point where even the slightest amount of stress can cause addicts to go on a food-eating spree. Just like all addicts, they often do not see a problem with their habits. When you attempt to restrict or modify their eating habits, they may experience withdrawal symptoms similar to those seen in substance addictions like irritability, anxiety, depression, fatigue, and intense cravings for the foods they have been consuming in excess. Plastic surgery addiction. This often happens when an individual with body dysmorphia meets plastic surgery, where even after multiple cosmetic-enhancing surgeries, it can never be quite enough. To them, an eyebrow would be too high up or down, and their nose would be just a fraction off to the left. They may or may not hate themselves, but they'll always feel that more can be done in a never-ending cycle to get the perfect look. Even the simple anticipation of improving one's appearance through cosmetic surgery can flood the brain with happy chemicals. The brain may begin to associate cosmetic procedures with feelings of satisfaction and self-confidence, paradoxically increasing the need for more surgeries. When unable to undergo cosmetic procedures, individuals with plastic surgery addiction may experience withdrawal symptoms, making them unstable. And yet, interestingly enough, despite undergoing multiple cosmetic procedures, individuals with plastic surgery addiction may never feel fully satisfied with their appearance. They may continue to identify new areas they perceive as needing improvement, leading to a cycle of surgeries and dissatisfaction, leaving them in a never-ending cycle of self-hate. In extreme cases, some people have tried to turn themselves into dolls or fictional characters through surgery. It shows how much they're caught up in changing how they look. Relationship addiction. Codependency addiction is when someone becomes so focused on a relationship that they neglect their own needs and identity. The compulsion in addiction comes from deriving self-worth through sacrificing for and caretaking of their partner. Rather than chasing new romantic highs, codependents stay deeply dependent even in unhealthy partnerships. They have difficulties establishing boundaries and prioritizing themselves. Their sense of purpose and validation is built entirely on being needed by their partner. Some people with relationship addiction might start mirroring their partner's likes, dislikes, and even mannerisms so closely, it's as if they're trying to become their partner's clone to make the relationship perfect. It's a bit like copying someone's homework because you think it's the only way to get a good grade. This addiction arises not from pleasure-seeking, but from attempts to heal insecurities and abandonment fears, often caused by childhood experiences. Codependents compulsively put others first, losing their sense of independence in the process. They get the hit from facilitating their partner's needs and receiving any scrap of appreciation or love in return. This reinforces the unhealthy, lopsided cycle of self-neglect. Zika virus outbreak. The reason why Zika was such a huge issue wasn't what it did to a person, but what it did to those who were yet even to be born. The virus, primarily transmitted by the Aedes mosquito, could also be passed from mother to child during pregnancy, leading to severe birth defects and developmental issues in infants. At the height of the Zika outbreak in 2015 to 2016, there was an alarming association with a significant increase in cases of congenital birth defects, particularly microcephaly in newborns. In Brazil, the largest area of the outbreak, reports of an unprecedented surge in the number of babies born with abnormally small heads and brain damage caused widespread panic among expectant mothers and the general public. Images of infants with microcephaly, a condition associated with incomplete brain development, flooded the media, amplifying the fears and anxieties surrounding the outbreak. The uncertainty regarding the long-term consequences of Zika virus infection, coupled with a lack of an effective vaccine or treatment at the time, fueled a sense of helplessness and vulnerability. Pregnant women were advised to take extreme precautions, such as avoiding travel to affected areas, using insect repellents, and employing measures to prevent mosquito bites. The fact that the Aedes mosquito was so common in these areas made the Zika outbreak even worse. Middle East Respiratory Syndrome. The Middle East Respiratory Syndrome, MERS, was a viral respiratory illness caused by a novel coronavirus coronavirus, first identified in Saudi Arabia in 2012. Just like anywhere else in the world, the people of Saudi Arabia had a close relationship with animals of their choice, camels. Saudi Arabia is mainly a desert, and the camel is among the only animals in the world built for the desert. From one animal, the people living here could get transport, meat, and milk. Because of this close contact for prolonged periods, it would take just one mutation for the virus to find the perfect chance to jump the ship from animal to man. In most cases, the symptoms were those of a bad flu. Still, in severe cases, the infection could rapidly progress to pneumonia and acute respiratory distress syndrome, ARDS, where there is widespread lung inflammation leading to difficulty breathing. In ARDS, the tiny air sacs in the lungs, called alveoli, become filled with fluid, making it hard for oxygen to reach the bloodstream and depriving vital organs of oxygen. MERS was particularly dangerous for specific individuals because of its high fatality rate. According to the World Health Organization, the estimated fatality rate for MERS was approximately 35%, significantly higher than that of other respiratory illnesses like influenza or even the SARS outbreak in 2013. The elderly, individuals with chronic disease such as diabetes, cancer, or chronic lung disease, and those with compromised immune systems were at the highest risk of severe complications and death from MERS. Between April 2012 and November 2019, the WHO reported a total of 2,519 laboratory-confirmed cases of MERS, including 866 associated deaths, representing a fatality rate of approximately 34.3%. SARS. SARS, severe acute respiratory syndrome, emerged in late 2002 in the Guangdong province of China. It was a previously unknown strain of virus that spread rapidly through close human-to-human contact. For our purposes, a man in the Guangdong province, let's know him as Patient X, would be among the first to wake up one morning feeling unusually exhausted and feverish. He brushed it off as a common cold, but as the day progressed, he began experiencing a persistent dry cough and tightness in his chest. Initially, he thought it might be the flu, but the symptoms grew more severe, making it increasingly difficult for him to breathe. Over the next few days, the man's condition deteriorated rapidly. He developed a high fever, body aches, and a deep hacking cough that left him gasping for air. Concerned, his family rushed him to the hospital where doctors were confused by his worsening respiratory distress. As more cases with similar symptoms began emerging in the region, healthcare workers realized they were dealing with a new and potentially deadly respiratory illness. The man's condition continued to decline, and he required supplemental oxygen to help him breathe. Chest x-rays revealed pneumonia-like infiltrates in his lungs, and medical staff struggled to manage his rapidly deteriorating condition. Despite receiving the best available care, the man's body could not overcome the severe respiratory failure caused by this new virus. The SARS outbreak quickly spread across several countries, primarily through international travel. By the time it was contained in July 2003, it had affected 26 countries across multiple continents. According to the World Health Organization, the SARS epidemic resulted in 8,096 confirmed cases and 774 deaths worldwide, with a fatality rate of approximately 9.6%. Ebola outbreak. At the height of the Ebola pandemic, almost everyone in the world was paranoid because of the terrifying and seemingly uncontrollable nature of the outbreak. A disease that could make victims bleed from every hole in their body and cause unbearable pain was all the news could talk about. The images and stories emerging from the center of the outbreak in West Africa showed overwhelmed healthcare facilities, healthcare workers becoming infected, and bodies piling up as the virus killed even more people. And with most of the public often receiving wrong information about how the disease could affect healthcare workers wearing full hazmat suits, the paranoia that anyone coming from Africa could have it reached new heights as the World Health Organization announced that the Ebola outbreak in West Africa had resulted in a total of 28,616 reported cases and 11,310 deaths across the three countries. The outbreak was believed to have started in December 2013 in Guinea, where the first cases of the deadly the Ebola virus disease were reported. However, it wasn't until March 2014 that the outbreak was officially recognized, and by that time, the virus had already spread to neighboring Liberia and Sierra Leone. The initial symptoms of Ebola included fever, headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained bleeding or bruising. These symptoms typically appear between 2 to 21 days after exposure to the virus. As the disease progresses, if you were the unlucky 35% that had caught the more virulent strain, you might get the worst symptom yet, bleeding everywhere. It might start subtly, a trickle of blood from your nose, a tinge of red in your vomit, but soon it could be from everywhere, your gums, your eyes, even places you wouldn't expect. And the worst part is that even if you survived the disease, you'd only be partially immune to that particular strain of Ebola, and you'd still have to worry about the other 5. But with the introduction of vaccines, the cases of Ebola would soon reduce, and outbreaks would eventually stop. Yellow fever. In 2015, men and women all over the Democratic Republic of Congo, DRC, and Angola began to have high fevers, chills, and severe headaches. While a majority of them dismissed it as a usual flu that started around that time, as it was the rainy season. However, as the days passed, their conditions rapidly deteriorated, with some developing jaundice, a telltale sign of yellow fever. When patients came to the hospitals in the affected regions, medical staff were overwhelmed by the influx of patients exhibiting the classic symptoms of yellow fever: high fever, nausea, vomiting, and the unmistakable yellowing of the skin and eyes. Healthcare facilities, particularly in remote areas, would struggle to cope with the surge of patients, many of whom would require intensive care and supportive treatment. The lack of specific antiviral treatments for yellow fever would further complicate efforts to manage the outbreak. As the virus spread rapidly across borders, facilitated by the movement of people and the presence of the mosquito carrier, health authorities in both the DRC and Angola scrambled to implement emergency vaccination campaigns. However, the limited global supply of yellow fever vaccines would pose a significant challenge, leaving many communities vulnerable to the outbreak. Despite the efforts of international organizations and aid workers to support the affected countries, the outbreak would continue to take a heavy toll. By the time it was under control, the 2016 yellow fever outbreak in the DRC and Angola would result in 965 confirmed cases, with 137 deaths, according to the World Health Organization. Swine flu. The swine flu started in early 2009 and quickly spread across the globe. It was a new strain of the influenza virus that combined genes from human, swine, and bird influenza viruses. The epidemic got its name from the theory that the strain came from the close contact with pigs in Mexico, because the pigs are generally known to be dirty animals that more often than not are known not to be too particular about their hygiene. Hence, it just made it the perfect breeding ground for all sorts of viruses capable of unlimited mutations. The initial symptoms of the H1N1 virus were similar to those of seasonal influenza, including fever, cough, sore throat, body aches, headaches, chills, and fatigue. However, some individuals, particularly those with underlying health conditions, experienced more severe symptoms such as pneumonia and respiratory failure. As the virus spread rapidly across countries and continents facilitated by international travel, it became a global health concern. The World Health Organization declared it a pandemic in June 2009, the first influenza pandemic in over 40 years. According to the Centers for Disease Control and Prevention, CDC, it is estimated that between 151,700 and 575,400 people died worldwide from the H1N1 virus during the first year of the pandemic. In the United States alone, the CDC estimates that between April 2009 and April 2010, there were approximately 60.8 million cases of H1N1, resulting in 274,304 hospitalizations and 12,469 deaths. Chikungunya. The chikungunya virus outbreak is an ongoing global health concern, with multiple outbreaks occurring since 2004. With this mosquito-borne viral disease is currently affecting millions of people worldwide. Once the virus jumped to urban mosquito populations, it found an ideal environment to spread rapidly among human population. The ease of international travel and the widespread distribution of the Aedes mosquitoes facilitated the virus's spread to other regions, leading to outbreaks in Africa, Asia, the Americas, and part of Europe. While the acute phase of the illness can be excruciating, the worst aspect of chikungunya is that in some people they develop chronic, long-lasting joint pain that can persist for months or even years after the initial infection. Meaning if you were the unlucky percentage to contract this disease once, you'd be in constant and uncomfortable pain for almost the rest of your life. Coupled with the lack of an effective treatment or vaccine, as the virus spread across regions, reports of widespread outbreaks and the agonizing symptoms experienced by patients fueled a sense of panic and anxiety. Recent studies have shown that chikungunya has affected over 1.7 million people in the Americas alone since its introduction in 2013. With all these long-lasting issues, the best way currently would be to avoid mosquitoes at all costs. Measles. Despite measles being a disease that has an easy-to-access vaccine, there are still hundreds of outbreaks worldwide, particularly because, paradoxically, those affected the most are either too poor to afford it or just don't believe in vaccines. Measles is highly contagious and can easily be transmitted through direct contact with respiratory droplets or through the air when an infected person coughs or sneezes. The fact that it remains airborne for up to 2 hours means that once an outbreak starts in an unvaccinated population, little can be done to stop it. After a few days, a red blotchy rash appears, starting on the face and spreading downward to the rest of the body. In some cases, where bad sanitation meets bad luck, certain individuals who might have a weakened immune system can get a lethal strain of the virus, which can lead to severe complications, including severe pneumonia, encephalitis, brain inflammation, and death. In recent years, several measles outbreaks have occurred worldwide, often originating from imported cases in travelers or migration patterns. The major ones are the 2019 measles outbreak in the Democratic Republic of the Congo, where over 6,000 cases and 89 deaths were reported, and the 2018 to 2019 measles outbreak in the Philippines, which resulted in over 33,000 cases and 594 deaths. Dengue fever. Dengue fever is a viral disease transmitted once again by Aedes mosquitoes. Usually, these mosquitoes breed in stagnant water sources, such as puddles, water tanks, and discarded containers that can collect rainwater. Outbreaks of dengue fever typically occur in tropical and subtropical regions, where the climate and environmental conditions favor the mosquito to thrive. The dengue virus has 4 different strains of infection, with one strain providing lifelong immunity against that particular strain, but not against the other 3. This means that individuals can be infected with dengue fever multiple times, as many times as you come in contact with these mosquitoes. The disease spreads through the bite of an infected Aedes mosquito. When a mosquito bites an individual infected with the dengue virus, the virus enters the mosquito's system. After an incubation period of 8 to 10 days, the mosquito can transmit the virus to other individuals through its bite. The symptoms of dengue fever typically appear within 4 to 7 days after being bitten by an infected mosquito. Common symptoms include high fever, severe headache, pain behind the eyes, and skin rashes. Sometimes dengue fever can progress to a more severe form called dengue hemorrhagic fever or dengue shock syndrome. With this, you'd enter the worst stages, with bleeding plasma leakage where the virus can cause a drop in platelet levels, leading to bleeding and clotting issues, and your organs being basically shot with these viruses, destroying them, which will almost always lead to death. Preventing dengue fever outbreaks usually involves controlling the mosquito population by eliminating all breeding sites, using insecticides, and making sure there aren't spots for them to hide in. Asthma. Asthma is your body's way of overreacting to a trigger known as an allergen, or exercise, cold air, pollution, respiratory infections, and stress. If you were to suffer from this, your allergen could be anything from flower pollen to dust. You could be walking down a street lined with blossoming trees on a sunny spring day. The gentle breeze carries clouds of pollen your way. At first, you might just feel a slight tickle in your throat or some mild coughing as your body recognizes this harmless allergen. but for someone with asthma, it triggers an excessive inflammatory response. Your lungs' airways, which are normally relaxed and open for easy breathing, begin to overreact. The muscle bands around the bronchial tubes constrict, narrowing the airwaves. Simultaneously, excessive mucus starts building up, further obstructing the constricted passages. You begin gasping and find it increasingly difficult to catch your breath. As the asthma attack progresses, your chest feels tight, like a heavy weight is pressing on it. Each inhalation requires intense effort, but fails to pull in enough oxygen. You start coughing uncontrollably, trying to expel the mucus and open your airways, but to no avail. Panic sets in as your breathing becomes shallower and more complex. In a severe asthma attack, your bloodstream can lack the proper oxygen to supply vital organs. Left untreated, you might turn pale or blue from inadequate oxygen, experiencing dizziness, or even lose consciousness. Diabetes. Diabetes is a chronic disease caused by the body's inability to produce or effectively use the hormone insulin, which regulates blood sugar levels by allowing glucose from food to enter cells and be used for energy. You see, whenever you eat food, the food provides energy in the form of glucose when broken down, but your body can't take up this energy without permission from the insulin to do so. Insulin tells your body how much and when to take up this glucose. There are two main types of diabetes. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys insulin-producing cells in the pancreas so that you don't produce insulin. Type 2 diabetes, the more common form in which the body either doesn't produce enough insulin or doesn't use it effectively, a condition known as insulin resistance. Unlike type 1, which is mainly genetic, Type 2 is linked to lifestyle factors like being overweight, inactive, and having a poor diet. As of 2021, 537 million adults aged 20 to 79 worldwide were living with diabetes, about 1 in every 11 adults worldwide. According to the International Diabetes Federation, this number is expected to rise to 783 million by 2045. Your body's organs are very delicate, meaning a rise in anything they're not used to. They will and shall often react badly. Patients with uncontrolled diabetes via insulin shots or drugs can develop issues such as diabetic neuropathy, where the sugar damages the nerve's distal, farther parts of your body. Over time, you lose sensation in your fingers and feet, so the next time you receive a random injury on your foot, which is a lot, you never notice, meaning over time the injury will become infected and the toes will have to go. Uncontrolled diabetes is insane, as it can cause anything from blindness and kidney failure to an increased risk of heart disease. Remember, you do not have to be overweight to develop type 2 diabetes. As long as your lifestyle is unhealthy, there's always that risk. And once it starts, there's no going back to a careless lifestyle, as you'll constantly need to monitor your sugar ranges every day after every meal. Hypertension. Hypertension is when the force of blood pushing against the artery walls is consistently too high. The body's blood vessels are a connected system of pipes powered by a single pump, the heart. Should your arteries become narrowed or rigid over time, they force the heart to work harder to pump blood through them. If left uncontrolled, hypertension can lead to severe and potentially life-threatening health issues, with the cause being anything from an unhealthy diet, smoking, stress, or even genetics. According to the World Health Organization, an estimated 1.28 billion adults aged 30 to 79 had hypertension in 2019, with its most significant cause being obesity. With hypertension, it often shows no outward symptoms, earning it the name silent killer because in specific individuals with things called aneurysms, it is like a weak spot in a blood vessel that bulges out like a balloon. It can happen in any blood vessel in your body, but it's most common in the brain. Due to the high pressure, it can burst, causing severe problems like bleeding, a stroke, or even immediate death. Peptic ulcer. These diseases refer to painful sores or ulcers that develop in the stomach lining or the first part of the small intestine called the duodenum. As you can imagine, having wide open wounds in your stomach can be extremely painful and discomforting. These open wounds usually occur when the protective mucosal lining is damaged, allowing the stomach's digestive acids and enzymes to irritate and further erode the sensitive gut tissues. ulcers. The two leading causes of peptic ulcers are infections with the Helicobacter pylori bacteria and long-term use of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin. NSAIDs reduce the amount of mucus in the stomach, reducing its protection from stomach acid. The Helicobacter pylori bacteria is good at one thing: weakening the protective lining of the stomach and small intestine. Once it infects the body, it breaks down this protective barrier, leaving the stomach and intestine vulnerable to the damaging effects of stomach acid. As a result, ulcers can form, causing discomfort and potentially severe complications, like eventually forming the early stages of cancerous growth. According to the Centers for Disease Control and Prevention, about 1 in 10 people develop a peptic ulcer at some point. However, luckily enough, with a thorough antibiotic treatment of about 3 to 4 drugs, H. pylori infections are usually eliminated, and medications that reduce stomach acid levels will help reduce the pain. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs, filling them with fluid or pus and causing cough, fever, chills, and difficulty breathing. Viruses, bacteria, or fungi typically cause pneumonia, though bacterial pneumonia is the most common and severe form in adults. What could be a mild flu when left untreated can develop into the tiny air sacs of your lungs, filling up with fluid and mucus from the infection, with less air being able to move in and out of the lungs with each breath. This makes it increasingly difficult for the lungs to oxygenate the blood properly. You begin to experience shortness of breath as your body attempts to draw in more air to compensate, with each breath getting harder and harder to catch. As the fluid and debris get worse, they can completely obstruct the small airways, bronchioles, in some regions of the lungs. This shuts off those sections and prevents any air movement or gaseous exchange. As more lung tissue becomes damaged and oxygen levels drop, the heart has to work harder to compensate. If gas exchange becomes severely impaired across a large portion of the lungs, this could potentially lead to conditions like respiratory failure. Pneumonia can permanently scar the tiny air sacs, reducing overall lung capacity even after treating the infection. This is why prompt antibiotic treatment for bacterial pneumonia is crucial to limit lung damage as much as possible. Because of this, it is often called the child killer, as it accounts for over 2.5 million hospital admissions and about 672,000 deaths among children under 5 each year globally. Sickle cell anemia. Sickle cell anemia is an inherited red blood cell disorder that affects hemoglobin, the protein that carries oxygen in the blood. It is caused by a mutation in the hemoglobin gene that causes the red blood cells to become stiff, sticky, and shaped like sickles or crescent moons. These abnormal sickle-shaped cells can get stuck in small blood vessels, blocking blood flow and oxygen delivery to tissues in the body. As you can imagine, when the blood vessels get swollen, it can lead to extreme pain. The sickle cells are also fragile and break apart prematurely, resulting in chronic anemia, a lack of blood. Both issues reduce the amount of oxygen going to tissues and organs, so they cannot function properly. Approximately 300,000 infants are born with sickle cell anemia each year, and the prevalence is higher among those whose ancestors came from sub-Saharan Africa, South America, the Caribbean islands, and Mediterranean countries, because the genetic mutation that causes sickle cell anemia is thought to have come from areas where malaria is or was once prevalent. People carrying one copy of the gene are less likely to develop severe forms of malaria, providing a survival advantage in regions where the disease is common. As a result, the gene became more prevalent in these populations over generations. Arthritis. Arthritis is a general term for conditions that cause joint pain, swelling, stiffness, and decreased range of motion. It affects people of all ages, though risk increases with age. Even though arthritis is often seen as an old people disease, it affects people of all ages. The two most common forms are osteoarthritis and rheumatoid arthritis. Osteoarthritis is where the cartilage cushioning the ends of bones is gradually eaten away. And just like the wheels of a car, your joints are normally well-oiled and move smoothly. In arthritis, it's the bearings in the wheels that start to wear out. In osteoarthritis, the tires on the wheels wear down over time. Without enough tread, cartilage, the wheels' joints start to grind against each other, causing friction damage and a lot of pain as your bones rub together constantly. Rheumatoid arthritis is an autoimmune disorder where the body's immune system mistakenly attacks the joints. This causes chronic inflammation that can damage cartilage, bone, and surrounding tissues over time. It typically affects smaller joints like hands, wrists, and feet in a symmetric pattern on both sides, causing a swan neck deformity appearance. There is no cure for most arthritic conditions, but treatments aim to relieve symptoms and improve quality of life. Urinary tract infections. A urinary tract infection, or UTI, can occur in any part of the urinary system: the kidneys, ureters, bladder, or urethra. However, most infections involve the lower urinary tract, like the bladder and urethra. UTIs are very common, especially among women, because unlike men, the normal bacteria on their organs are extremely sensitive to changes like pH. Various bacteria strains can cause it. These bacteria typically enter the urinary tract through the urethra and begin to multiply, causing inflammation and infection. Sexual activity can almost always push bacteria closer to the bladder, increasing UTI risk. It would usually start with experiencing discomfort or irritation during urination, often accompanied by a persistent urge to urinate even when the bladder feels empty. This urge can be quite intense and frequent. Another symptom is a burning sensation or pain during urination. Bacteria are set up on the urethra, causing inflammation and swelling. As urine is usually acidic, the pain can range from mild to unbearable. As the infection progresses, the urine may appear cloudy or reddish due to the presence of blood or pus. Left untreated, UTIs can lead to more severe consequences, such as acute or chronic kidney infections. Chronic kidney infections, if left unresolved, may result in permanent kidney damage, impaired kidney function, or even kidney failure over time. The good news is that as long as you notice these symptoms early, most of them can be treated with antibiotics. Migraines. They are more than just bad headaches. Migraines are an extremely incapacitating collection of symptoms, usually lasting between 4 to 72 hours if untreated. Here is a description of someone suffering from a severe migraine attack. You would usually feel the telltale signs of an impending migraine as you wake up: a dull ache building behind your eye and a small visual disturbance creeping into your peripheral vision. This would be a migraine aura. Over a short time, the pain would rapidly intensify into a severe throbbing headache concentrated on either side of the head. Even the faintest sounds, like a ringing phone or foot traffic outside, could cause extreme agony. And what's worse is a majority of these migraines rarely respond to over-the-counter painkillers, meaning you need more and more potent drugs over time. According to the Migraine Research Foundation, migraines affect over 39 million Americans and are the third most prevalent illness in the world. Unfortunately, there are no cures for this, but certain anti-migraine medications are shown to help. Russia typhus. Often called jail fever because its spread was heavily associated with overcrowded and unsanitary living conditions in prisons and military camps, which were relatively common after World War II. The symptoms would often start with something similar to a bad flu, but as the disease progressed, relentless chills and sweats followed those symptoms, the pounding headaches that seemed to split your skull in two, and the bone-deep exhaustion that made every movement feel like an uphill battle. With typhus also causing a rash of red spots that spread across the body, adding to the misery and discomfort, and delirium, hallucinations induced by fever, often blurred the lines between reality and nightmare, leaving sufferers feeling lost and disoriented. Perhaps the scariest aspect was how typhus could strike anyone, regardless of age, gender, or social status, at a time when the rich did not walk the same streets as the poor. Refugee populations fleeing the conflict in Russia carried the disease with them, bacterium, leading to outbreaks in refugee camps and communities throughout the region. The Russia typhus epidemic claimed 2 to 3 million lives between 1918 and 1922. During this epidemic, it was reported that some sufferers in their fever-induced delirium would strip off their clothes in the cold, mistakenly believing they were burning up. This bizarre behavior often led to hypothermia, complicating their condition further. The Japanese Plague. The Japanese plague was caused by the same bacterium responsible for bubonic plague from 1185 to 1333 in Japan. This pathogen was transmitted by fleas that infested rats, and the crowded and unsanitary conditions of urban life provided the perfect breeding ground for rats and fleas, fueling the spread of the disease. After coming in contact with the pathogen, usually through contaminated food, the victims of the plague would wake up one morning with a fever and swollen lymph nodes, only to find themselves bedridden within hours. The symptoms were gruesome. A searing headache, excruciating pain in the limbs, and the telltale blackening of the skin that gave bubonic plague its ominous nickname, the Black Death. As the plague progressed, victims succumbed to delirium and madness, their bodies eaten by the disease. It claimed an estimated 30 to 40% of the population, which totaled 1.8 to 2.4 million people, leaving communities reeling in its aftermath. Smallpox. During the colonial era in South America, smallpox epidemics ate through indigenous communities, primarily during the 16th and 17th centuries, the same period as European explorers and colonizers arrived, and within a century, the population of Mexico fell from about 25 million to 1.6 million. Indigenous communities with no prior exposure to the disease went from fighting flu and mild colds that their immune systems had adapted to fighting the deadliest disease in the world at the time. The odd thing about this disease was its transmission mode, prolonged face-to-face contact. For example, if you hugged an infected loved one too long and your face stayed in contact with their face, a distinctive rash would appear within days, starting on your face and spreading to the rest of your body. The rash would progress to fluid-filled blisters, eventually crushing over and forming scabs, leaving permanent scars. The smallpox virus spread rapidly through close contact with infected individuals or contaminated objects, moving like wildfire through highly populated indigenous communities, wiping out entire villages, which led to a catastrophic impact on the indigenous populations. Communities were overwhelmed by illness and death, and mortality rates soared as high as 90% in some areas. The loss of life was staggering, and millions of indigenous people perished as a result of the disease. Efforts to control the spread of smallpox were limited during the colonial period, as understanding infectious diseases and public health measures was rudimentary at best. The smallpox epidemics forever altered the demographic landscape of colonial South America. Kokolitzli. Kokolitzli was an epidemic that struck Mesoamerica in the late 16th century. The word Kokolitzli is derived from the Nahuatl language, spoken by the Aztec people of central Mexico, meaning pestilence or plague. The origins of Kokolitzli remain unknown. Entire villages fell silent as the disease claimed the lives of men, women, and children alike. It was a nightmare come to life with no apparent rhyme or reason to its merciless rampage. While the symptoms of Kokolitzli included the classic signs of infectious disease like fever, headache, nausea, and vomiting, some victims would even start to bleed from the ears. But unlike most diseases, Kokolitzli went beyond causing just physical harm. It was reported that some afflicted individuals exhibited bizarre symptoms such as uncontrollable laughter or crying fits. Severe neurological symptoms, including hallucinations and delirium, often accompanied these emotional disturbances. The erratic behavior of those affected added to the mystery and fear surrounding the epidemic. Historians estimated that as much as 80% of the indigenous population in some regions perished during the epidemic, leaving behind ghost towns and shattered communities. Hundreds of years later, despite centuries of research, the true cause of Kokolitzli remains unknown and debated among historians and scientists to date. Some theories point to viral or bacterial infections, while others suggest environmental factors or even deliberate acts of biological warfare. But no one knows for sure. Malaria. Malaria, a mosquito-borne disease caused by parasites, has plagued humanity for centuries, with numerous epidemics occurring throughout history. To put this in context, some publications mention that malaria has killed about 50 to 60 billion humans, which is half of all humans ever to exist. Meaning, if you were unfortunate enough to be born in any of the tropical countries before the invention of modern medicine, you'd stand a 1 in 2 chance of dying from this. Interestingly, the pathogen that causes malaria is carried by tiny mosquitoes smaller than a grain of rice, who hunt for blood based on scent. Studies even show that beer drinkers are likelier to get bitten by a mosquito because they emit an odor the insects find irresistible. The symptoms of malaria can vary depending on the type of parasite, would make you feel like you have the flu, but much worse, with recurring bouts of fever and intense body aches, along with chills, sweats, headache, and fatigue. One scary fact about malaria is that in some cases, the infection can lead to a condition known as malarial coma. This severe complication of malaria can cause patients to enter a state of profound unconsciousness resembling a coma, often lasting for hours or even days. During this time, individuals may appear unresponsive and unaware of their surroundings. Despite the efforts of modern medicine, malaria remains a significant public health challenge in many parts of the world, particularly in sub-Saharan Africa, where millions of people, especially children under 5 years old, still fall victim to this preventable and treatable disease each year. Polio. During the peak of the epidemic in the 1940s and 1950s, parents were living in constant terror of their children falling ill, knowing that this highly contagious viral infection could lead to paralysis, muscle weakness, and in severe cases, death could strike at any moment. During that period, the disease killed over 500,000 people worldwide each year. The symptoms of polio varied wildly, which meant that you could go from having mild flu-like symptoms to severe paralysis in a few weeks. Many poliovirus victims experienced the former, having only to deal with fever, headache, sore throat, and fatigue, similar to the common cold or flu symptoms. Its most horrific feature was its impact on children. Put yourself in hospitals overflowing, with rows of patients confined to iron lungs, devices used to help individuals with paralyzed respiratory muscles breathe, filling the wards. But while it primarily affects children, in some rare cases, adults who were previously unaffected by polio during childhood could contract the virus later for the first time as adults, or when the virus reactivates after lying dormant in the body for many years, which would leave them paralyzed. The development of the polio vaccine, first introduced by Dr. Jonas Salk in 1955 and later improved upon by Dr. Albert Sabin with the oral vaccine, marked a turning point in the fight against the disease. Thanks to widespread vaccination efforts, the incidence of polio declined rapidly in the years following the vaccine's introduction. By the late 1970s, polio had been eliminated from the United States, and the epidemic that had once struck fear into the hearts of millions became a distant memory. Paul Alexander, who sadly died a few years ago at 78, was paralyzed with polio at age 6 and relied on the machine to breathe. The scarlet fever. Scarlet fever, a bacterial infection caused by a group A Streptococcus bacteria, led to a significant epidemic in Australia during the late 19th and early 20th centuries that claimed over 8,000 lives. This epidemic occurred primarily in urban areas where overcrowding and poor sanitation facilitated the spread of the disease, and children were particularly susceptible to the infection. Scarlet fever typically begins with symptoms that make you believe you have strep throat, like a sore throat, fever, and swollen glands. However, if you have scarlet fever, what would set it apart is the distinctive rash that follows, covering the body in red sandpaper-like bumps and strawberry tongue. During the acute phase of the illness, the tiny bumps on the tongue's surface could become swollen, red, and covered in a white coating, strikingly resembling a strawberry. The scarlet fever epidemic in Australia peaked around the late 1800s and early 1900s, coinciding with similar outbreaks in other parts of the world. It was, however, particularly concerning due to the potential for serious complications, including rheumatic fever, a disease that inflamed the joints. Efforts to control the spread of scarlet fever during the epidemic focused on improving sanitation, promoting hygiene practices, and isolating infected individuals to prevent further transmission. The Naples Plague. The origin of the Naples Plague, also known as the Great Plague of Naples, is a devastating epidemic that ravaged the city of Naples, Italy in 1656. The plague was another spring from the bubonic plague, believed to be traced back to ships arriving from Levant, a French island in the Mediterranean off the coast of Riviera. It spread rapidly throughout the city, fueled by the dense urban population and unsanitary living conditions. Just like the bubonic plague, the symptoms of the Naples Plague were sudden fever, headache, and weakness, followed by painful swellings in the lymph nodes known as buboes. These buboes often turned black as the disease progressed, which, as mentioned earlier, is the source of the name the Black Death. Victims would also experience severe respiratory symptoms, including coughing, difficulty breathing, and bloody sputum. The impact of the Naples Plague was terrible, both in terms of human lives lost and the social and economic disruptions it caused. Streets were littered with the bodies of the dead, and makeshift hospitals overflowed with the sick and dying. Entire families were wiped out, with communities that were left in a state of shock and mourning from the 150,000 to 200,000 people who died from the plague. Chikungunya. The chikungunya epidemic was a viral disease that spread rapidly through Caribbean communities, causing illness and disruption that affected millions of people across the region between 2013 and 2014 and claimed over 2,000 lives. It was transmitted primarily by mosquitoes, you guessed it, which usually thrive in tropical and subtropical climates. However, while remote island communities faced the threat of this mosquito-borne disease, densely populated urban areas were not spared either. As these vectors multiplied and spread, so did the risk of chikungunya transmission. Within 2 to 12 days of being bitten by a disease-carrying mosquito, a patient would find themselves experiencing debilitating symptoms like severe joint pain, headache, fever, muscle pain, and a rash. Chikungunya translates to that which bends up, referring to the characteristic symptom of severe joint pain that causes patients to adopt a stooped or hunched posture. Families struggled to care for loved ones who were suddenly unable to walk or move without pain, and within months, neighboring islands and countries reported escalating case numbers, medical resources were stretched thin, and hospitals were filled to their limits. The economic impact of the chikungunya epidemic was also terrible because tourist arrivals plummeted as travelers canceled or postponed their trips to affected areas, fearing the risk of infection. Hotels, restaurants, and other businesses reliant on tourism revenue suffered losses, leading to job losses and economic hardship for many in the region. It was a double blow for Caribbean countries already dealing with high levels of poverty and vulnerability. First, they had an epidemic, and now they had fewer resources to treat it. The epidemic eventually subsided as efforts to control mosquito populations and prevent transmission proved effective. Public health measures such as mosquito control programs, community education campaigns, and surveillance efforts also helped contain the spread of the virus. Additionally, as more people were infected and developed immunity to the virus, the overall prevalence of chikungunya in the population decreased. Vitamin E deficiency. If your nervous system is an extensive network of highways and byways, think of vitamin E as the traffic controller, ensuring smooth coordination. Without sufficient vitamin E, this system could experience some gridlock, with you having impaired coordination, muscle weakness, and in severe cases, even paralysis. It's not an ideal situation for performing everyday tasks with ease. Vitamin E also helps to bolster your immune system's capabilities. A deficiency might outmatch your immune cells, making you more susceptible to infections and illnesses. It's like sending your security team out without proper backup. Red blood cells rely on vitamin E to maintain their integrity and prevent premature destruction. Without enough of this nutrient, you could develop a form of anemia, which can leave you feeling tired and weak. Not exactly the ideal state for tackling your daily responsibilities with vigor. The good news is that maintaining adequate vitamin E levels is achievable through a balanced diet rich in plant-based oils, nuts, seeds, and leafy greens. Scurvy. While not as prevalent as it was hundreds of years ago because of greater access to better quality fruits and vegetables, if you were a pirate in the 1500s, this would most likely be the illness that took you out, as long voyages on the ocean with dirt-poor nutrition would have exposed you to vitamin C deficiency. Because hard biscuits and literal leather jerky are not good sources of vitamin C, your body would begin to experience fatigue, weakness, and lethargy due to the impaired metabolism of proteins, carbohydrates, and fats. Without vitamin C, your body would struggle to produce collagen, a protein necessary for the growth and repair of tissues, including skin and blood vessels. This would lead to slow wound healing, easy bruising, and opening previously healed wounds. As scurvy progresses, your body experiences more severe symptoms, such as teeth just falling out, gum diseases, skin bleeding, and internal bleeding if left untreated. Iron deficiency. With iron being a major component in your blood and necessary for it to carry oxygen, women with heavy period flows are the most affected group in this deficiency, along with vegetarians and high-performance athletes, making this deficiency the most common in the world, affecting almost 30% of the entire world population. Iron is needed to form hemoglobin, the protein in red blood cells that carries oxygen from the lungs to the rest of the body. Without enough iron, the body cannot produce an adequate amount of hemoglobin, leading to a condition called iron deficiency anemia. Your body would have difficulty producing enough healthy red blood cells. As your cells and tissues don't receive enough oxygen, you feel tired, weak, and constantly short of breath. Without enough iron, your body may also experience reduced brain function, as your brain is a unit when it comes to energy usage, taking about 20 to 25% of the total available energy in the body, despite making up only 5% of the weight. But paradoxically, excessive iron intake can be toxic, so you have to balance with eating a lot of fortified cereals and breads, eggs, and dried fruits such as apricots and raisins. Vitamin D deficiency. In the northernmost parts of Greenland, above the Arctic Circle, there are periods of continuous darkness in winter known as polar nights, where the sun usually won't rise above the horizon for several weeks. With this capital city of Nuuk during the winter solstice in December, there are approximately 5 to 6 hours of daylight. Along with other factors like high rates of loneliness and overall lack of activity, during this time of 2022 reports, Greenland had among the highest suicide rates. You see, staying in the sun can help produce vitamin D because your skin synthesizes this vitamin when exposed to ultraviolet B (UVB) rays from sunlight. People who live in areas with limited sunlight exposure, such as Greenland, experience higher risks of vitamin D deficiency. Because vitamin D regulates mood and well-being, these people are usually more prone to depression. Without vitamin D, your body would have difficulty absorbing calcium and phosphorus, essential minerals for maintaining strong bones and teeth. This can lead to osteomalacia in adults and rickets in children, which might be uncommon now. However, before modern nutrition, it would be a common sight to see children with skeletal deformities, which can include bowed legs, knocked knees, and a protruding breastbone. Foods that are a good source of vitamin D include to prevent all this are usually fatty fish such as salmon, tuna, and mackerel, egg yolks, fortified milk, orange juice, and cereals. Vitamin B12 deficiency. With a normal and balanced diet in which you regularly eat animal-based products, you'd probably stand a good chance of getting all the vitamins you'd need, as animal products contain almost 90% of everything you need to live a relatively okay life. But on the other end of the spectrum, because vegans or vegetarians eat an almost entirely plant-based diet and, more often than not, lack B12, vegans and vegetarians are at the highest risk. Vitamin B12 is extremely important for making your DNA, which is necessary for producing red blood cells in bone marrow. Without an adequate supply of vitamin B12, red blood cells can become abnormally large and ineffective, leading to megaloblastic anemia. This condition results in fatigue, weakness, and shortness of breath. If you were to remain committed to your vegan diet despite all the dizziness and shortness, the next on the list would be nerve damage and neurological symptoms such as tingling or numbness in the hands and feet, difficulty walking, memory problems, and even depression or dementia in severe cases because it is involved in the formation of the protective covering, myelin sheath, around nerve fibers, which helps facilitate proper nerve signaling. The reason it takes so long for the symptoms to start is because the vitamin is stored in the liver, and it can take several years for the body's stores to become depleted before deficiency symptoms appear. Calcium deficiency. The reason why you have weak and brittle bones is probably because you didn't take your glass of milk every day when you were young. You see, calcium is essential for building and maintaining strong bones. Without adequate amounts, individuals are at an increased risk of developing osteoporosis, a condition characterized by low bone mass and an increased frequency of fractures. This is especially bad for older adults, as bone density naturally decreases with age. Calcium also plays a big role in muscle function, and a deficiency can lead to muscle cramps, spasms, and overall muscle weakness. This can affect daily activities and potentially increase the risk of falls, particularly in the elderly. For the most part, the good news is that the best dietary sources of calcium include dairy products like milk, yogurt, and cheese, leafy greens, vegetables, fortified plant-based milk alternatives, and certain nuts and seeds. However, the body's ability to absorb calcium can be affected by various factors, such as vitamin D levels, meaning you'd also have to make sure to spend enough time in the sun to help the milk do its job. Iodine deficiency. You might find it hard to believe, but a few decades ago, this was a massive issue worldwide as compared to the world we live in today. Yet the solution was rather simple: iodized salt. Decades ago, access to iodine was limited to only a few foods, which a majority of the world didn't really have access to. You see, a certain organ in the body called the thyroid gland requires iodine to produce thyroid hormones, which play an extremely important role in regulating metabolism, growth, and development. When the body lacks sufficient iodine, the thyroid gland attempts to compensate by increasing in size, leading to the development of a visible goiter, an enlargement of the thyroid, which makes the front part of your neck swell up to sometimes huge sizes. One of the worst effects of iodine deficiency is the damage to fetal development during pregnancy. A severe and prolonged lack of iodine can lead to intellectual disabilities, stunted growth, and other developmental abnormalities in the developing fetus, a condition known as cretinism. However, nowadays, because of iodized salt, the rates of this disease has gone down significantly. Vitamin A deficiency. The biggest consequence of vitamin A deficiency you may have heard of to eat your carrots is vision impairment. Vitamin A is the leading cause of preventable childhood blindness globally. It maintains the health of the cornea and retina, and a deficiency can lead to night blindness. In this condition, the eyes struggle to adjust to low-light conditions. In severe cases, vitamin A deficiency can cause complete blindness, particularly in children. Children with vitamin A deficiencies may experience growth and developmental issues. Vitamin A is usually needed for cell growth and differentiation, meaning children lacking this can result in stunted growth, compromised bone development, and other developmental challenges. Vitamin A is usually found in both plant and animal sources. Animal sources such as liver, egg yolks, and dairy products provide preformed vitamin A, retinol. Omega-3 fatty acid deficiency. Omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are usually known for their heart-healthy properties. A deficiency in these nutrients, on top of things like diet, lifestyle, genetics, and overall health, can put you at a greater risk of heart disease, including high blood pressure, irregular heartbeat, and potentially life-threatening conditions such as heart attack or stroke. But the other thing that DHA can also do for you is how it can improve your memory. You see, DHA is a big part of your brain, particularly in the cerebral cortex, responsible for higher brain functions such as memory, attention, language, and cognition. Whenever there's a deficiency during critical periods such as pregnancy or childhood, it can negatively impact cognitive abilities, learning, and behavior. Even in adults, a lack of omega-3s has been linked to cognitive decline, depression, and an increased risk of neurological disorders like Alzheimer's disease, highlighting the importance of maintaining adequate levels throughout the lifespan. Without it, you'd have dry, rough, and flaky skin and dull, brittle hair, affecting overall appearance and potentially contributing to self-esteem issues. Magnesium deficiency. The most notable issue of this deficiency is the development of frequent muscle cramps, spasms, and overall muscle weakness. This is especially a big problem for athletes and physically active individuals, hindering their performance and recovery. Magnesium's role extends beyond muscle and nerve function. It is also involved in various metabolic processes, including the regulation of glucose and insulin levels. Deficiency in magnesium may contribute to insulin resistance. Insulin resistance occurs when cells become less responsive to the hormone insulin, which is essential for regulating blood sugar levels. As a result, the pancreas produces more insulin to compensate, leading to higher than normal insulin levels in the blood. Despite elevated insulin levels, cells do not adequately take up glucose, causing blood sugar levels to remain elevated. Over time, this can lead to prediabetes, type 2 diabetes, and other metabolic disorders. Interestingly, magnesium deficiency is often referred to as the invisible deficiency because its symptoms can be vague and easily overlooked. Additionally, specific populations such as older adults, individuals with stomach disorders, and those with chronic diseases like diabetes may be at the highest risk of deficiency. Magnesium can be found in wide numbers of food sources like whole grains, nuts, seeds, leafy green vegetables, and certain types of fish. Zinc deficiency. The most well-documented impacts of zinc deficiency is its effect on immune system function. Zinc is needed for the proper development and functioning of immune cells, and a deficiency can severely weaken the body's ability to combat infections. As a result, individuals with zinc deficiency are more susceptible to illnesses such as pneumonia, diarrhea, and other infectious diseases, leaving them vulnerable to potentially serious health complications. People with zinc deficiency may find their sense of taste and smell reduced because without zinc, taste and smell receptors can't function, and insufficient levels can result in a reduced ability to feel flavors and aromas. It is estimated to affect over 1 billion people worldwide, and individuals with chronic illnesses such as diabetes, chronic kidney disease, or malabsorption disorders are at a higher risk of deficiency. While zinc is present in a variety of dietary sources including meat, seafood, legumes, and fortified cereals, certain factors can increase the risk of deficiency. Individuals with conditions that affect zinc absorption, such as Crohn's disease or other gastrointestinal disorders, may have difficulty absorbing zinc.